Hello, everyone. Today we'll be talking about contraception resources in the Spokane community. My name is Brooke Kotlars, and I am joined by
Caitlin Bellacura
and Kennedy Erickson.
This presentation is part of Washington State Pharmacy Association WSU chapter's program called FRESH, or Pharmacists for Reproductive Education and Sexual Health. Let's start with the introduction. Today, we will be talking about how contraception works, where to access contraception, emergency contraception, long-term contraception, what type is best for you, and financial resources. By the end of this presentation, you should be able to identify financial resources for emergency and long-term contraceptives regardless of socioeconomic status, describe how to access emergency contraceptives, recognize different types of emergency contraceptives and which is suitable based on patient-specific factors, and identify when it is appropriate to seek long-term birth control and additional care. What is contraception? It is just another word for birth control, which is designed to prevent pregnancy. What is the difference between emergency and long-term contraception? Emergency contraception is best used after unprotected sex as a one-time use. This means it is necessary to use emergency contraception after each incidence of unprotected sex. Long-term contraception is also designed to prevent pregnancy, but over a longer duration, and is more effective than using emergency contraception. It can also help alleviate heavy or irregular periods, as well as reduce acne and other hormonal imbalances. It is important to note that both do not prevent against sexually transmitted infections. Do emergency contraceptives cause abortions? No. The primary way emergency contraceptives work is through preventing ovulation. What this means is that it prevents the body from releasing an egg to be fertilized. And now I'll hand it over to Caitlin to talk more about emergency contraception.
Hello, everyone. So the way to determine what emergency contraceptive is best for you depends on how long it has been since you have had unprotected sex, as well as your preferences. The first emergency contraceptive that I wanted to go over with you guys is called levonorgestrel, or the progestin-only pill. Brand names for levonorgestrel include Plan B One Step, My Way, Next Choice One Dose, Take Action, and After Pill. This is available over the counter, which means you don't need a prescription for it, and it is best taken within 3 days after having unprotected sex. Another emergency contraceptive is ELA, or ulipristal acetate. This does require a prescription, but it can be taken after a longer duration since you've had unprotected sex. It's best taken within 5 days after having unprotected sex. The Paragard intrauterine device, or the copper IUD, is also another emergency contraceptive option. It must be inserted by a healthcare provider, and it works best when inserted within 5 days of having unprotected sex. It is the most effective form of emergency contraceptive. It can be very expensive without insurance. Another cool thing about the copper IUD is that it also works as a long-term birth control. So once it is inserted, it can stay within the uterus for up to 10 years and prevent pregnancy in that amount of time. Sometimes long-term birth control pills can be used as emergency contraception, but not all formulations can be used in this way. So it's best to talk to your pharmacist to determine if this is a good option for you. The best time to take an emergency contraceptive is as soon as possible after having unprotected sex. Just because it is nicknamed the morning after pill does not mean you have to wait until the morning after. You do not need a prescription to get an emergency contraceptive. For Plan B, one step specifically, you don't need a prescription or ID to buy it over the counter, and you can be any age or gender. But for other brands and types of emergency contraceptives, it does require a prescription from the doctor if you are under the age of 16. You can get emergency contraceptives from pharmacies, online websites, as well as Planned Parenthood. Pharmacies such as Rite Aid, Target, CVS Pharmacy, Walgreens, Walmarts, and more carry emergency contraceptives over the counter. I also wanted to go over long-term contraceptive options that you can discuss with your prescriber. Types of long-term contraception include pills, intrauterine devices or IUDs, patches, shots, rings, implants, and more. These are some hormonal options, but you can also talk to your doctor for non-hormonal options if that is your preference. You do need a prescription for long-term birth control. In Washington State, medical doctors, osteopathic doctors, midwives, and nurse practitioners are able to write those prescriptions. Pharmacists can renew these prescriptions, but they are not able to prescribe new contraceptive prescriptions. And now I will turn it over to Kennedy and Brooke to talk about resources in the Spokane community.
All right, starting out with some online resources. The first on the list is afterpill.com, which is an FDA certified manufacturer of generic Plan B that is $20 per unit plus $5 for shipping, or you can get it faster through their Amazon service. Next is the Pill Club, which is an online medical service that is focused on women's health and services all 50 states. They provide online appointments that you can access through the link provided and prescriptions that are mailed out to you. They provide long-term birth control as well as a generic Plan B as an add-on to orders. The Pill Club is also an accredited digital pharmacy, which is a designation given by the National Association of Boards of Pharmacy that verifies their license, legitimacy, and ensures that they are a reliable resource for medications online. A quick way to verify if an online pharmacy is an accredited digital pharmacy is if the site ends with the .pharmacy or through the NABP website linked here. And now I will hand it over to Kennedy to talk about more resources in the community.
Hi everyone. So for the remainder of the presentation, I'm going to talk to you about how to access financial resources that can help you afford some contraceptives. As of right now, all insurance plans offered through the Washington Health Benefit Exchange covers all forms of contraceptives, so both emergency and long-term, at no cost, regardless if you've paid your deductible for the year. If you're unsure whether or not your insurance covers contraceptives, you can do one of two things. First, you can go on the website and look at your insurance provider's drug formulary, which is a list of medications your insurance will cover. The second thing you could do is you could call the number on the back of your insurance card if they provided you with one, and just ask a representative which contraceptives will be covered. If you don't have insurance, the first thing I would recommend to you would be to apply for Apple Health Medicaid insurance. We have linked the application for you on the slide. They will have you answer a few questions to determine your eligibility, such as your income, age, and citizenship status. They typically cover 30-day supplies of long-term contraceptives at no cost. If you do the application and find out you're not eligible for Medicaid, Family Planning Only can offer some assistance, which is also linked on the slide. Family Planning Only can be helpful, especially if you're not a citizen, which is not a qualifying factor. If neither of these are preferable for you, Chaz pharmacies have prescription assistance programs, or you can try some online coupons. If you apply and find out you are eligible for family planning, contraceptives, condoms, diaphragm kits, and some clinical services are covered for you based on your ability to pay, which is also known as a sliding scale. The clinical services offered family planning is linked to the slide, which you can check out if you'd like some more information. Chaz pharmacies, which are found all over Spokane, also offer prescription assistance. If you are seen by a Chaz provider, you can get some assistance with the copays at their pharmacy. If you would like to use coupons, I would recommend trying out GoodRx, WellRx, or some other websites or apps which can be accessed. However, make sure your pharmacy accepts these before you drop off your prescription. For emergency contraceptives, you can check out the manufacturer's website to see if there are over-the-counter coupon options available. Planned Parenthood is one of the clinics that takes family planning and offers many resources for women seeking reproductive services. Planned Parenthood has appointments at a reduced cost and offers STI testing and treatment, contraceptives, and education on how to choose the right birth control. If you don't have a primary care provider, Chaz and Planned Parenthood are both great options and are offering in-person and online appointments at this time. We have linked how to make an appointment through either means on the slide. We would like to thank the University of Washington Pharmacists for Reproductive Education and Sexual Health, the Washington State Pharmacy Association, Dr. Julie Akers and Dr. Jennifer Miller for their help and contributions to this project. If you have any questions, our emails are listed on the slide. Thank you.
Thank you.